Welcome to Talk Me Healthy. My name is Sherry Keating, founder, Diabetes Care Consulting. The goal of Talk Me Healthy is to provide you education on how to live your best life every day starting today. Each show will bring a different health-related topic and exciting guests to share their expertise, passion, and personal stories. My hope is you will hear something that motivates you to make a small step towards living a healthier, happier life. Today's topic will be dementia, Alzheimer's, and the caregiver. My guest is my friend, Kathi Crowley from RiverCourt Residences. She's the Director of Community Outreach, and I just want to say thank you for coming today, taking the time to come and talk about this subject that, as you know, is very dear to my heart.
Thank you for having me.
Oh, you're so welcome. So, as you know, my dad passed away in December, and he had dementia. And so I'm sure a lot of our viewers out there have somebody that they know and care about going through this very difficult disease. So first I want to hear a little bit more about yourself and why you became interested in this field, and then we're going to talk about dementia and its many facets.
Okay, wonderful. Well, I've been working with seniors for about 24 years now. I got into gerontology because we were caregiving for my grandmother probably about 30 years ago, and we had absolutely no idea what we were doing. There were no resources back then. There were no Alzheimer's associations. There were no specialists, and people really didn't share experiences like they do now. Like, you can reach out when you were experiencing the things with your dad and the changes in your dad. You could talk to other people. People were comfortable talking about what was going on at home. Back then, we kind of suffered in silence. We didn't really share because A, we didn't know what we were doing. B, we didn't know what this was. And the only thing we knew about was mental health things. And people would automatically go to, she's going nuts, or I'm going nuts. So you kind of suffered quietly at home. And you didn't really reach out to community members. And there wasn't support groups back then. There weren't books written. So we did honestly everything wrong that you might do in caregiving. But so I use it in teaching. I do a lot of educational programming. I worked at the Alzheimer's Association for quite some time, and I was the director of education. So I would go into the community and train informal caregivers, family members, and then train formal caregivers, like people that work in assisted living or nursing homes or hospitals, because it's really not common sense. There's actually a lot of training that goes in, approach, understanding the disease process. So I took my experiences of what not to do and turned it into this might work. So there's a lot of simple tricks when it comes to caring for someone with memory loss, and sometimes just some simple things to get you through your day. Take that stress level down a little bit. So I like to impart some wisdom and share my experience as a caregiver, both informally for a family member and formally working in senior living.
Oh, that sounds great. And we definitely want to talk about those tips that you have to share. I think, first of all, the statistics that I've been reading about were really staggering.
Okay.
Shocking, actually. I mean, having a dad with dementia, he started out with multi-systems atrophy, and apparently that is a risk factor for dementia, and he ended up having dementia, and he was this strong military sergeant, and he was in control, and then all of a sudden, through this process over 5 or 6 years, he became dependent, and his life wasn't his anymore. He was in control of others' decisions, and I saw the stress my mom was under and the heartbreak of our family. And as I'm reading the statistics, I'm just in awe that so many people are going through the same thing that we went through.
And then add the fact that there's probably a lot of people that don't still talk about it. So I think the stats probably are even more mind-blowing than what's on paper, because so few people are still hesitant to talk about it or to share their experiences. So a lot of times through the Alzheimer's Association, councils on aging, things like that, you find out it's even more than what's researched or documented. But the one that always staggers my mind is that 1 in 2 people 85 and over have some form of dementia. Now, dementia comes in many forms, but most senior living, like an assisted living or a nursing home, average age is about 86, 85, something like that. So that tells you that half of the people that live in those settings have some kind of dementia or memory loss. So I think training's huge. So even though you might not have a memory care community in your nursing home or your assisted living, you have folks with memory loss just statistically alone. So I'm an advocate for training. There are regulations about how much dementia training you need to have in each state. Most places go way above it because that's really where the core of the management of someone with memory issues is how you approach, how you communicate. And it really takes a special person to work with someone with dementia. It can be stressful. It can be frustrating if you don't have the right tools or the right understanding of the disease process. So I really think it begins with education. I think it's education for the families too, because I know we didn't know what was coming down the road. When my grandmother first moved in with us, she was just a little forgetful. She'd forget to take a pill, or she left something on the stove, and she'd say, "You're not going to stick me in one of those nut houses, are you? And I'm going crazy. You're not going to shove me away somewhere." And we said, "Of course not. You're just a little forgetful." And back then, that's all she knew. We have all these wonderful options now for home care and assisted living, and all there was nut houses to her. But we didn't know through the disease process that people can become bowel incontinent. People will have swallowing difficulties. They could become bedridden. We didn't know all that was coming down the road. And so when she said, "You're never going to stick me somewhere, you're never going to put me away somewhere," we said, "Of course not. We can handle this." We didn't know what was coming down the road. So it seems like brutal conversation sometimes for families now, but I think it's so important for people to know the disease process and what potentially could happen. Because they use the word insidious. Most dementias are insidious dementias, where they kind of you notice changes, and then it's stable for a little while, and then a little more changes. It's kind of slow and steady. Vascular dementia usually is from a stroke, so it happens a little more sudden, acutely. Okay. But most dementias, it's, in the beginning you're like, is there something going on? What do you want? She's 86. And then the next day she's fine, and you start to question yourself a little bit as a daughter or a caregiver. But over a period of time, you'll notice a slow, steady decline. So I think as advocates for seniors, I think it's our duty to get people educated on the disease process and what dementia is it, and is it treatable? Is it non-treatable? There's so much that goes into really caregiving and charting a path.
Mm-hmm. It's interesting to say, and like, how would we have known? Like, I don't remember having an aha moment with my dad to say, "Oh, Mom, I think Dad is getting dementia, or maybe he has Alzheimer's." I didn't have that aha moment. I didn't live with my dad. I lived next door to my dad. I saw him frequently. I remember one day I went for a ride with him, and he wasn't driving on the road. He would be very close to the mailboxes. And I said to my Mom, "Did you notice that Dad is not driving like on the road correctly?" She's like, "No, I haven't noticed that." I'm like, "Well, maybe you should get in the car and drive with him." So I just started to pick up little things, but I'm 55. I go upstairs, sometimes I forget why I went upstairs. I put my keys down. What did I do with my keys? We live in such a hurried world that I think sometimes our mind is so preoccupied with other things that it's, so how do I know? Am I getting dementia? Because I know a lot of people who have family members fear that that's going to be their path. Yep. And maybe it is their path. And how do we know? So I guess the question is, am I at risk for dementia because my dad had dementia? If I am, how do I know my forgetfulness? Is it aging or is it dementia and the start of it? And then if it is, what do I need to do to be proactive?
Yeah, that's a wonderful question. And more people should be asking it just to understand this huge number of people that live, our neighbors, our family members. I'm going to address the one thing about the driving. I'm going to mention that part of a lot of disease, dementia processes, different forms of dementia, they have visual issues. So driving becomes a big safety concern. They have trouble with peripheral vision. So you're not seeing here and you're not seeing down here. So a lot of times if you're at a table in, say, a memory care community, and there's 4 people sitting at a table having lunch. A lot of color coding helps if you have white against black against, and then you have your green beans on a white plate with a black placemat. That kind of helps navigate. But you'll find people that will reach out and have other people's food because they simply don't see their plate right here. So just moving simple plates out like that. There comes a time when driving is just inappropriate for people. I talked to a family member not long ago whose mom was still driving, and based on many things in the conversation, I was scared to be on the road myself. But she said she does, we live in a small town and she does okay, and she navigates always by just taking right turns. So she figures out how to get from A to B by just right turn, because she won't make left turns. So there comes a time usually with doctor intervention, and so the aha moment
we had to take his license away, and I'm telling you, that was like, you would have thought we took his life altogether away.
Independence,
it was
dignity.
very difficult, and he fought us for a long time.
And
but we had to hide the
typical.
keys,
Typical.
or else he was going to get the keys and drive. And it was really a heartbreaking time for him.
That's independence. That's manhood. That's
exactly.
I'm in charge. All those things. But really, you look at not only his safety, but the school kids on the corner somewhere.
Absolutely.
But that's, and I don't mean to say your family is, it's just like everybody else, but it's very typical circumstances that families just have to make hard decisions, and it's heartbreaking for you. It's this is your strong. My dad was a Marine. You think of all those things, but then you say, you know what, for everybody's sake, But I think a lot of it too is the approach. A lot of times you have to do something drastic. Dismantle the car, take away the car, do the keys, that kind of stuff. Same thing as placement and facilities. Sometimes no one skips out of their house into a nursing home or an assisted living, but it's a hard decision that a family had to make for everyone's sake. So a lot of times the aha moment, like you said, is a safety thing. It's the driving that, this just can't go on anymore. It's the stove. This can't happen anymore. The number one reason people get admitted into altered housing usually is medication management. So a mistake with medication. So if you have memory loss, and just initially, things aren't too drastic, pills are some of the first signs. Medications are. So the daughter will go in and check on mom. She set her thing out for the week, and she's doing okay. She's not driving anymore, and she's okay. She just stays at home, and I visit. Then the daughter goes and sees it's Tuesday's pill box has not been taken. Or the whole thing has been taken because I'm not sure what day it is, and I'm not sure I remember what I took, so I better take some more. So that there's usually seniors, there's all these comorbidities or diabetes.
Diabetes is one of them.
So then add that medication mismanagement to it.
Be a huge problem.
It's a big one. So a lot of times simple interventions keep someone very safe. And there's a lot of electronic things where the pills are dispensed electronically.
And there's alarms to remind them to take.
Correct. A lot of things. Yeah. Then there comes a time when that might not just be enough. So then we talk about placement in assisted living or skilled facilities.
And my dad made us promise to keep him at home. And we did. We were fortunate enough. He did. He was a veteran, and so the disabled veterans actually paid for someone to come into our home so many hours per month per year, and they was able to provide care. So my mom had some respite time. And then across from your facility, my dad went to daycare there, and he went 3 days a week, and he loved it. It was wonderful, and it gave my mom a break. But we did keep him at home, and were able to keep him at home until he passed away, and he did pass away at home. But I could tell towards the end it was really very difficult. And when I was reading the statistics about the caregiver, 35% of the caregivers say their health has gotten worse taking care of somebody at home.
Very true. And then when you're caregiving, say you're a couple at home, like your parents, and the caregiver's health starts to suffer because they're usually heroic. They've drop their doctor's appointments. They don't eat right because they're, got a million things to do. They don't take care of themselves mental health wise. You're just so stressed out. So the caregiver ends up in the hospital, and what happens to the person at home? They get placed. So we always try to say, make sure just like that, the airplane scenario, you put your mask on first before you help your kid. You got to take care of yourself before you can help somebody else. So respite for the caregiver, reaching out for help, disease education. My grandmother said, you're never going to stick me somewhere, right? And most people do. Most people want to stay at home forever, and I would too, and I completely get it.
Absolutely.
It's when safety becomes an issue. That's usually my fork in the road, or conversations with family. Either the caregiver, you're going to lose the caregiver, so save mom, at that, or safety is, leaving the stove on, or wandering inappropriately out of the door.
Falls. My dad fell constantly. We had a lifeline, but he would forget to put it on.
Of course. Or push it if you need to.
Right. So, he fell a lot. We'd get calls to go over and help pick him up. And then they go through the anger stage where, the caregiver could be really at risk if they get into that angry stage, and they may start acting out. Not that it's their they want to, because my dad was the most gentle man, but there was a point in this process that he became very angry.
It happens quite often, unfortunately.
And then he didn't remember being angry.
But your mom does.
But my mom totally remembered and never forgot.
Yeah.
So the dynamics are just so hard, and it's so hard on all of the family members. We have a very big family and very close. It took its toll on all of us.
I think that goes back to the simple caregiver tip kind of stuff to help your mom get through her day safely that we didn't have.
Tell me about those tips. So what are some tips from your experience?
I'll talk about my grandmother. So it was Mima, and Mima stayed with us for a while. And initially it was just, simple things. And they had a big, huge home, and that was just too much for her. So a lot of times people make changes because they don't want to deal with a house anymore, which is kind of not crisis driven then,
right?
Which is smart. But we know now that someone with dementia can't remember 5 minutes ago sometimes. So it starts off with your short-term memory that starts to get eaten away. What did I have for breakfast? I don't remember grandchildren maybe. I remember my daughter. And it just slowly kind of digs deeper into your memories. So we would say my dad had a woodworking shop in his basement. And we lived in a big, huge Victorian home right on Main Street with someone who wandered. So I didn't know.
Wandered?
Yeah, so my dad would go down into the basement to work on he had like a shop down there. And we had a door in the kitchen down to the basement. And there was a lock on it. So my dad would say to my grandmother, "Now, Mima, I'm going to go downstairs and work in my shop. You're going to hear a lot of noise. Don't get worried, it's just me." And she'd go, "Oh, okay, fine." And then my dad would go down in the basement and start all his machines up and start working. And she got scared because she heard these noises and didn't remember that little conversation. So she would lock the door and lock my dad in the basement. And my dad would have to crawl out the window constantly. But we thought we could say, "Mima, don't forget." 5 minutes later, that conversation was completely gone. So now, we know not to think that she's going to remember that conversation always. But if you take that lock and put it up at the top of the door, she wouldn't even see it. She wouldn't even know.
Right.
So managing the home environment becomes very important. And your dad with the falls, if you can't see what's going on here and here, you're at risk for falling. Steps over doorways and carpet patterns and carpets, those things. So little house adjustments sometimes go a long way. So just move. She was about 4'6". If we would have put the lock at the top of the door, she wouldn't have even seen it.
Right.
So let's, like on our memory care community, our doors are camouflaged with bookcases. It looks like a bookcase instead of a door, so someone's not constantly like trying to, "I need to get home, I don't belong here." They don't even see the door. So sometimes simple tricks, like they call it physical environment, physical plant, help someone from not getting frustrated or don't have the visual cue to want to walk out the door. A lot of times family members need to hide coats, move shoes out of eyesight because those are triggers. I see a coat, I want to walk. If we move the coat, I don't have that sense of wanting to leave. So simple little things like that just help somebody get through their day. The don't you remember that we did all the time inappropriately. I didn't have breakfast. "Mima, don't you remember you just had breakfast? You just cleared the table."
That
she doesn't remember.
So much frustration to them. They're
both
like,
of
"No,
them.
I don't remember."
And it's scary. If you really don't remember and someone keeps telling you over and over again, that's scary. What's wrong with me? Or the sense of, like you said, with your dad always wanting to stay home. "I want to go home." A lot of times, of course you do. I don't blame you. And men, home is king of the castle. I'm in charge here. But you're remembering home probably 40 years ago or 30, a different home sometimes. And back then you were strong, you were in charge, you made all the decisions. So when you say "I want to go home," a lot of times it's "I want to go back to who I was, back to that place where I knew everything and I was
in control.
I was making the decisions." And when people want to go home, I think my grandmother, a lot of times it was she felt in charge. She was a large matriarch of a large Italian family, and I just want to go back to that feeling of understanding what's happening around me. I'm not scared all the time. I'm not frustrated. People are asking me for decisions. So often people don't ask, decisions through the day. They just kind of decide for somebody, and that's hard for someone with dementia. So simple choice goes a long way. My grandmother, her big thing was, "I want my mom. I want my mom. I want my mom." And in our wisdom of not knowing what we were doing back then, we would say, "Your mom passed away." And that's horrible news. If I said that to you, it's the worst news you could possibly hear. And she didn't remember that her mom had passed away. So we said it over. We gave her terrible news over and over and over again. So through the Alzheimer's Association, we teach we taught about, it's really the feeling of home that you want. It's not necessarily that physical plant of that home. I want to feel safe. I want to feel in charge. I want my mom usually means if you're having a bad day, who do you want? I want my mom. You know, my mom would make me feel better. My mom would make sense of this.
Well, that totally makes sense because my dad, when he was away from my mom, he used to have severe anxiety, and he'd want us to get on the phone and call her. But he thought my mom was his mom.
Exactly.
So he lost the idea that my mom was his wife. At the end, he used to think it was his mom. And he would say, I want, you know,
she makes them feel good.
Yeah, so
she makes
that's
them feel
why
safe.
he did that. That makes perfect sense.
They kind of interpret the environment for, usually the main caregiver kind of makes sense of the world that doesn't make sense to them. So, you know, someone says, where do I belong? What do I do next? There's a lot of that because they're so unsure of where they are in the day, what happens next. And that primary caregiver often says, don't worry, we're going to have lunch in a little while. Okay, so it must be around noon. It's, you know, that kind of navigate the day. And then when you remove that caregiver, that helped me figure out my day. Person is gone and they physically want it. Doesn't matter who it is sometimes, but they want to see you. And conversely, that primary caregiver is usually who they are angry with the most. The person that's giving up the most and giving up sleep and free time is usually
true.
They get angry with the most because I think
that's hard.
I think with my grandmother, I was the little boy who stole her boots. Like she would tell everybody, "You see that boy over there? He stole my boots." And I'm like, "Well, first of all, your boots are safe with me." But she just would misplace things all the time, and she would take it out because. Back to that normal kind of I lost my keys kind of what's the difference. She didn't remember that she had her boots in the first place and that she hid her boots. So if she can't find her boots, someone must have stolen them. And that's I think the difference, that line in the sand of what's normal, memory loss, or you are a busy girl, you have a million things going on, you have a lot on your mind. Misplacing your keys is normal. I did it with my cell phone just the other day. I was coming in many bags of groceries, cell phone in my hand, putting away groceries, and then I'm like, where's my cell phone? And I could walk my way through. Okay, I was walking in the door, and I put away the groceries, and sure enough, it had fallen into a bag that I put in the refrigerator, so my cell phone was in the refrigerator. I figured it out. Someone with memory loss a lot of times will say, I never had a cell phone. You must have stolen my cell phone. It's just we're busy and moving too quickly. Their take on it is very different, that there's usually a paranoia to it. So my grandmother's pocketbook was her number one thing. She had to have her pocketbook everywhere she went, and then she would hide it because it's so important. She would hide it places and then look for it and couldn't find it. So you must have stolen it because I just had it.
My dad used to always say somebody came into the room at nighttime and stole things from him.
They misplaced
and
them.
we would
I'm very good at finding things now. I find things in liners of bathrobes, push up ceiling tiles because it's very important to them
to have that.
Yeah, and then they forget where they put it, or they'll write themselves a note and forget that they have the note. So it's usually like, say in my building, we'll get a call at the front desk, someone stole my wallet. Okay, I bet you we can find it. Don't worry about it, and we'll, we don't argue with anybody, of course, but usually with some careful experience of look inside the pillowcases and look under the mattress. Usually there's 99.9% of the times in facilities or communities, it's really just someone hid something that's very important. And I think people forget what's important too. Like, my wallet is important to me, but sometimes something that you wouldn't think is important, people are hiding, and for some reason to them, they hoard it and they hide it. My grandmother's had a lot of jewelry that we still to this day have no idea where it is because she hid it. A lot of times it's in a tissue and then it goes in the garbage. And so there's a lot of vulnerability with people with dementia because of that paranoia. The TV too, I think, is big. And when you talk about your dad and people coming into the room, we really try to limit TV because they don't really understand what they're watching, and it can be scary. And we made the mistake of sticking my grandmother in front of a TV because it was something to do.
He always was in front of the TV,
and she can't interpret it. It's hard for your brain is a living, breathing organism that for you and I should be soft and moist. For someone with dementia, it gets a little harder, and plaque and signals don't get through as easily as they do for us. So when I see something on TV, it could be that I'm experiencing that, or 6 hours later, it scares me. And so it's usually not a good thing. Maybe some Andy Griffith episodes.
Right, because he wanted the murder mystery shows. And my mom's like, yes, we need to turn these off now because he's starting to act,
it's scary for them.
He's starting to get aggressive. So we changed him into like Family Feud and, something light like that. And, his ball games he always watched. But we never knew if he was really watching it and understood it or if it was just background noise, right?
But it really really important what you put in front. The sounds are scary. Remember, I don't remember the last 40 years, so when I see President Trump, I'm like, who is that? I'm thinking President Kennedy.
Okay,
It's another signal that I'm not really sure what's going on around me, and it's scary. So we do a lot of black and white movies, a lot of sing-alongs, but very, very little TV, just because it's misinterpreted so easily.
Right.
And my grandmother used to talk about the people that she lived with, that they had these horrible relationships, and this one hated this one, and this one's plotting to murder that one, and we couldn't figure out what she was talking about. It was soap operas.
I was just going to say, it must sound like a soap opera to me.
We put her in front of a soap opera all day long, and then she was kind of, or visual cues are tough too. She had, I don't know if you remember, but the white styrofoam heads with the wigs on them.
Mm-hmm.
She had several wigs and a shelf with all these different wigs on the white styrofoam heads, and she would always talk about the people who were watching her. And looking back, I really think the visual changes and the paranoia, and I bet you if I would have moved those wigs, the people weren't there anymore watching her. So we're careful about glare in windows because you see your reflection. We're careful about mirrors. If I'm 85 and I think I'm 40 because I've lost the last few years of my life,
you look in the mirror.
There's someone looking back at me that I don't know who that is.
That happens to me every morning.
You look great. That's you. But yeah, so we had in our bathroom we had I don't know if you remember this very 70s 80s house, a wall of mirrors, the square mirrors, and the toilet was next to this wall of mirrors, and she was struggling sometimes in the bathroom because she didn't know that lady next to her, and she was very private. I can't go, I don't even know her. And we didn't know, so it'd be, Mima, that's you. Look, you have a scarf on. To see the scarf, but to her, she was back in time, and so it was very scary for her.
Wow.
So there's a lot of simple tricks like that you can make adjustments either in a community like ours or in the home, that you just simple things that help with frustration. Now that we understand the disease process a little bit better, that help with that physical plant
Boy,
stuff.
there's so many questions that I'm thinking as you're talking. So where does one, so okay, I think my family member has some signs of dementia. First of all, is that the same as Alzheimer's?
I think let's back it up, because first of all, there's some treatable dementias. So I think you first need to figure out, is this a non-treatable dementia or a treatable dementia? So there are things that could happen physically to someone that produce some memory loss that there are treatments for.
Okay.
You're
and
a
that's
nurse.
a treatable dementia.
Yeah, you're a nurse, like a bad infection. You get a little delirious, a little confused.
Blood sugar problems.
Correct. B12 deficiencies, depression. Those are things that, if diagnosed correctly, you can treat. And then that memory loss would subside.
Okay.
There are non-treatable dementias. So that's usually where I tell families, don't just assume things. Go to a doctor, because it could be something very... And infections in seniors are bladder infections happen all the time.
Right.
So treat that bladder infection. You may see those symptoms subside. So once you figured out, okay, it's not a treatable dementia, it's a non-treatable dementia. There are a few, like I said, it could be alcohol related, it could be due to a stroke, it could be Alzheimer's.
Drugs.
Correct. It could be Alzheimer's. There's a couple different kinds of, but they all fall under that umbrella of a dementia. So how you care for them is generally the same. It's all about safety. It's all about making sure the medications are taken. It's about engagement. But some families just get to the point of it's a non-treatable dementia, and they don't try too much harder to put a name on it, because she's 92. At least we know we've got this far. I don't know how much testing I want to put her through. The way to get a very clear diagnosis usually is a biopsy. People don't want to do that, and usually that's upon autopsy. Some families want to know because of heredity.
Okay.
But you really can't. Usually people that have a diagnosis of Alzheimer's have probable Alzheimer's, because we've taken out what's probably treatable. So it's probably one of these, and I'm not going to put her through too much. I'm just going to make sure she's safe and loved and cared for, because it doesn't necessarily need a name on it other than a memory loss or dementia.
So is there screening tests, and then like a questionnaire that you can fill out and then take that to your primary care? Is that something you get online? Or...
They're everywhere. Most folks in our industry use what's called a mini mental, 30 questions. You would probably be a 30 out of a 30, because they're fairly simple questions. But for someone struggling with memory loss, take 100 and subtract by 7, see how far you get. I'm going to tell you 3 words, and in a few seconds I'm going to ask you what those words are. So you get a point for each word, that sort of simple stuff. So you get a score, so you're a 24 out of 30 or a 10 out of 30. It kind of, usually through the disease process, that number is going to decline. A lot of times it helps families kind of gauge where someone is. And a lot of times it's like your mom, you're there every day. and you don't see the same changes.
Right.
If you do something kind of statistic or number, it makes things, oh my gosh, she couldn't even spell world backwards, you know, and they can't figure that out. So it's an eye-opener sometimes, but it really gives families kind of a snapshot, and it's usually the beginning of education. You know, this is probably what's going to happen. These are the changes that you'll see. These are the safety concerns you might have. These are your resources. But usually when that declines, there's usually probably a change, either more home care or an alternative placement.
And where does this, so you take the screening test, you go to your primary care, then he sends you to a neurologist, or what?
Yeah, I think that's
is that the steps?
Yeah, our biggest challenge, I think, back when we were caring for Mima was that we were in a small town. We had one doctor. It was the same doctor that helped my mother give birth to me. You know, there's specialists and people really, neurologists and people that really specialize in these different disease processes. Back then, we went to the doctor because she, you know, walked out the front door in her pajamas on backwards in the middle of the night. She ate cat food because she thought it was trail mix. Like, what do you do? Back then, you go to your doctor. And he talked to her. And he said, okay, Mary, and he listened to her heart and listened to her lungs, and those are fine. And he checked her all over. She touched her toes and all this sort of stuff. And he said, dear Mary, how you sleeping? And Mima goes, oh, fine. My mom and I are like, no. How's your appetite? Oh, fine. And now we know it's really the caregiver as the historian.
Right,
the caregiver needs to be there to be the voice of the person.
That's right.
So, of course, we thought we were crazy. We're like, wait a minute, she's not fine. Don't talk to her. But we really didn't have the resources that you have now to really drill down and figure out what was going on. And those were things that we probably could have managed with a little education about the home and locks and all that kind of stuff. So I think the doctor is your first go-to. Put a name on it. Is it treatable? Is it not treatable? And then where maybe in this disease process is somebody. Sometimes families are too close to see just really how compromised somebody is.
Does a CAT scan show any brain damage or changes? And does that help to put them in a certain part of the spectrum, so to speak?
Yeah, your brain shrinks. So you'll see that. Your brain shrinks, your brain hardens. You know, you think of a picture of a healthy brain, there's all the lobes and all the crevices and cracks. You don't see that in a non-healthy brain. You'll see it shrinking, so the abilities are shrinking, and the messages don't get through as easily as they do for us now. So that's and that's not too invasive. Someone with memory loss, think of your dad. If you put them in an MRI or something like that, oh my gosh, that's too much.
Right.
And doctor's appointments in general they avoid because a doctor's going to figure out that I'm compromised.
Right.
So I'm going to cancel all my doctor's appointments.
Exactly.
I'm never going to go. I'm not going to. The world gets smaller, very simply, because I'm comfortable at home still. I have my easy chair and my remote, and my bathroom's right there.
You must have seen my dad because you're describing him to a T. He would sit in his chair with his feet up, with his special blanket, with the remote, with his TV on, and
it's easy. It's simple.
Yeah, he
I don't
would
have
just
to
be
navigate.
happy. I don't want to go out, and
it's scary out there.
Yeah.
So you start to. That's usually a sign for a lot of people is they start to their social world starts to get smaller because it's too confusing out there. I can't navigate a menu any longer. I don't remember names in the bowling league, that. So I'm just gonna stop things. And then when you start to bring it in the home, the grandkids are all over the place and they're loud and they're having a blast.
He did not like that. We have he had 18 grandchildren and six great grandchildren. When they were all there, you could tell he became very agitated and anxious, and he wanted them there, but it just overwhelmed him. So he would actually go into a different room, and I'd be like, "Dad, don't you want to hang with us?" And he's like, "No, it's kind of nice in here." So it just totally overwhelmed him.
Yeah, it's too much. It's the TV. It gets to the point.
Yeah.
A lot of times with memory care communities, it's very simple design. Usually, it's a lot of colors that are calming, smells.
Music.
That are,
he liked music.
Because that you don't forget. You never forget that.
And Johnny Cash.
Yeah,
he was a Johnny Cash lover, and we'd put it on, and he'd be very happy.
And so now you know. I know. I would have at the time when I tried to get my grandma in the bathtub and she wouldn't do it. If you do those soothing sorts of things ahead of time, that helps with some caring issues at home too. So, but yeah, it's just those are signs that something's changing.
Yeah.
And usually that's probably the time where you try to make a change into, like, say, a memory care community, because it's the programming that really benefits somebody. They stay active, they stay engaged at their level. We're doing things that you can only succeed at. And we're doing community service projects. We're doing things that really bring dignity, but yet we're keeping you awake all day.
And
so you
safe.
sleep at night. Yeah,
And
don't wake up in the middle of the night wandering around when there's not a lot going on. There's, of course, staff that will engage and help you get back to bed. But stay awake during the day where all the great programming is happening. And then you're tired. And then at home, sometimes there's reverse body clocks because the caregiver's so tired. Please take a nap. I need a nap too.
That's what happened. Is he would take a nap, and I would say, "Dad, go ahead, take a nap. You're tired." Mom would like, "Don't let him take a nap because he won't sleep. He'll be up all night." I'm like, "Well, Mom, look at the poor guy. Went to daycare all day. He's tired." She's like, "I'm the one up all night with him."
It's a good thing to be tired.
Yeah, so he would be tired, but then if he took an hour nap, he would be up all night for my poor mom, and then she'd be exhausted to start a whole new day and start this all over again.
That's where we really start with up and at 'em in the morning, thoughtful programming. They're involved. Our residents are involved in setting the tables and serving a lot of kids things, a lot of entertainment. But shorter attention span sort of thing, so maybe some folks with dementia can't last for an hour or two programming like our traditional assisted living folks do. So it's usually a program after program after program with a lot of choice. Would you like to do this or would you like to do that? Sometimes a group setting is great for you right now, and sometimes you need one-on-one quieter. So there's usually what they call parallel programming going on. So I'm asking a lot of questions to you because that goes a long way. Even someone that, like, we know they love cranberry juice and they drink cranberry juice every morning. We still say, would you like orange juice or cranberry juice?
Because they feel some independence.
And choice.
Right,
and choice.
Right.
So I think that helps families when you know you have to make a move and you know you have to make a change from the home setting. It's just not safe and the caregiver's overwhelmed. You're not saying, Dad, do you want to move somewhere? But you're saying, Dad, would you like the room with the view of the river or would you like the room with the view of the courtyard? And do you want to bring this chair or do you want to bring this chair? So he's still involved in the process, but the main decisions are usually the caregivers.
Right. So I've been to the neurologist. They've, diagnosed my family member with this. So is there medication that they put them on, or is there medication to prevent? If I'm worried because I'm a daughter of somebody who has dementia and I'm worried that I'm going to get dementia, is there things that I can do right now? Or in diabetes, if you have pre-diabetes, you can take a medication if you fit into the categories that require this particular treatment. You can have medication, but is there one for dementia that we can kind of slow the process or maybe reverse the process, or is that not something that can be done?
Not that I know of, to be honest with you. There's many schools of thoughts on all of this. There's still no one cure for it. Everybody's working towards it very diligently, but there's not something that's going to reverse it or stop it altogether. A lot of people think of brain games, keeping your brain active and staying involved.
Right, crossword puzzles and those
kind
of
stuff. If you don't use it, you lose it, sort of stuff. Dementia is non-discriminating, unfortunately. It goes from everywhere, from professors and lawyers and doctors and people who have teachers, thinkers, housewives. It doesn't discriminate. It affects many people. But there are medications that slow the process. There are medications that help with behaviors that people may see. As a person who is really an advocate for people with dementia and caregivers, usually medication is the last resource. It's really about education, and they're striking out because they don't understand why you're taking their shirt off and they don't know who you are. So a lot of times it's really great training and approach and communication and trial and error that everyone that I know of anyways was pretty up to date on the disease process. Pharmacological approaches are usually the last resort, and they're important. Sometimes they really help keep someone safe and in their settings a little
anxiety,
longer. Most
some
definitely.
things for anxiety.
Yeah, most definitely. But it's not medical. It's more treating a behavior sometimes.
Okay. So what does RiverCourt Residence offer? So now I have my family member and we're at home, and first of all, where does a caretaker go to resources to learn this education so that they can keep their family member at home as long as possible safely?
Yep.
And then when that happens and they can't get to that point, how do they find out what resources are out there for options?
I think there's many nowadays. There's folks like you and I that are in the community that are always trying to educate on keeping seniors safe and at home. Councils on Aging, each town has a wonderful resource in their Council on Aging or Senior Center. Alzheimer's Association is great. There's so much on the web now. There's so many books. Support groups to me are huge. You're sitting across from another daughter who's going through exactly what you're going through. I didn't have that. My
mom had a telephone support group.
That's perfect.
So she would get my dad to bed around 11, and then the women would call around midnight, and they would talk till like 2 in the morning.
Safe
because
zone.
that was their time that they didn't have to take care of their loved one. And so they would talk
Perfect.
2 or 3 times a week on
you
the
can
phone
talk to me, but
midnight.
I'm not the wife of someone with dementia.
Exactly.
Sometimes you really need to say,
Right.
I miss that intimacy with my husband.
Mm-hmm.
I miss that I miss going out dancing on Saturdays at the VFW. I understand it differently than somebody else does. I didn't know it was okay to laugh. When something silly happened, when I got her ready for a doctor's appointment, I turned back and she was naked and like Houdini. I couldn't believe it. But I can talk to another daughter or granddaughter, and that exactly is what happened to me. So it's okay to say I just want to jump off a bridge sometimes. It's okay to have those feelings, and now it's okay to share that with somebody else. Support groups are usually like that safe haven where you can't say anything wrong, and usually you'll talk about what you've done wrong, and everybody else will say, I did it too. So you don't feel so isolated or wrong, because you're usually caregivers are so well-intentioned. Yeah, so well-intentioned, and trying to keep them home as long as possible, which I understand. It's usually that line in the sand where that safety becomes a concern, whether it's wandering. A lot of people, she just walks to the grocery store and walks right back. We live in a small town. She's fine. The neighbors are looking out after her while I'm at work. Usually something happens. Usually she doesn't come back, or she's has a little fender bender. Or you come in and you see that the food in the fridge isn't right. Something usually is that eye-opener, that their safety, she's not eating right, whatever it is. And then you look at, it's a positive thing. Now the person who's sitting in the recliner and has no interaction and the caregiver stressed out, now they're out and about in activities and in the van and doing community service. So I think it's a restart on the computer. It's not that I can't do it anymore. It's with that disease process. This is what you need to do for that person. It keeps them engaged. It keeps them active. They have new friendships. It's like a new chapter in their life. And we do a lot of, you use the word respite, we do a lot of short-term stays where someone comes and tries, see what it's like to move in. Because most seniors really don't know assisted living. They know nursing homes, they know hospitals, they know their home, and assisted living is kind of new to them. So they come and they'll give it a try for a month, and very, very rarely does someone leave. It's usually, I should have done this a long time ago.
And how many beds do you have at RiverCourt Residences?
87 total.
And that's for memory care? Or is that all together?
We have 3 levels of care. We have independent living, full apartments. We have traditional assisted living. And then we have a memory care community with a secure entrance. So 3 levels of care all under one roof. But usually folks may start off in independent living. The house is too much. I'm glad to give up the house. Or it's a couple where they're caregiving and mom needs a little help with dad. So she can still stay involved in his care, but she's got some help. Traditional assisted living is a lot of eyes on kind of help. I can help you in the shower. I can help you with your meds. Your meals are taken care of, but you don't need a lot of clinical help. Memory care usually it's a higher staffing ratio because they need a little more help. Activities are a little more geared towards someone with memory care. And the environmental design is huge. Yeah.
Can you take your loved one out for the day and bring them home for Thanksgiving, or once they're there, they're there?
Nope. If the doctor says it's okay, we say it's okay. So usually there's some paperwork when someone's admitted. But yeah, it's their home. It's not a medical institution or any kind of Department of Health run. So if daughter's going away for the weekend and she wants mom to go, of course, and we want her to go too. So there are people that still have cars and drive, and it's appropriate. There are people who just go for the day and will go out and get ice cream. There's people that vacation with their, we had a lady that came back from a cruise with her daughter. So it's your home. So I think just because someone has a diagnosis of dementia doesn't mean life stops. It just goes on a kind of a different course a little bit. I lost a family member recently to brain cancer, and his course of treatment was radiation, chemo, nutrition therapy, some hospice, things like that. Some with dementia, their course of treatment usually is safety and help for the caregiver. That's so you're doing what that disease calls for when you finally ask for help, or get some help in the home, or get help for that caregiver. It's really what the disease requires based on the behaviors and their lack of insight, lack of judgment, safety concerns.
How about insurance? Now, if I were to say my dad was interested and we felt it was time to move him there, does insurance cover?
Only long-term care insurance, yeah. Long-term care insurance, but it's pretty rare in that age group. It's fairly new, not a lot of people bought into it, and they'll say 85-year-old plus. A few people have it, that will cover it. Most people, it's out of pocket. There are benefits through veterans, some assistance through veterans, but it's at our building or our community, it's kind of just like rent. You get a bill every month and you pay your bill every month, so private pay mostly. Medicare and Medicaid is usually a big question for a lot of people. What's the difference? But neither touch most assisted livings. We have a few beds that are through the Medicaid system, but Those are pretty few and far between. Medicare is the insurance for people who are 65 or over. Medicaid is financial assistance, and those come into play more at a nursing home.
Okay. What about pets? I know my dad loved my dog, and he, that would be important. I know a lot of older, the aging population, pets are so important. It's like their child.
Yep, and they come with them too. As long as you can take care of them. Yeah. They, I'm an animal fanatic.
Yes, you are.
If I had to leave my house and leave my animals and leave most of my stuff behind, that would be tragic. So yeah, because we love it. There are times when it might just not be appropriate any longer, that someone maybe through the disease process can't carefully take care of their pet any longer. But as we have the little doggy bags in our courtyards, because people are always walking their dogs out there. So yeah, it's important to.
It is important.
And kids are welcome, and visitors are 24/7. People stay overnight. It's your home.
Oh, that's wonderful. I mean, if you have to make that decision, it sounds like a wonderful option.
Yeah.
So I want to end with some key messages that you would leave our viewers so they can start thinking about, takeaways from what you've talked about a lot of wonderful things.
Okay.
So what are some 3 takeaway messages that you can leave with our viewers today on this topic?
Don't assume things. See a doctor, and don't let them cancel the appointment. We get that often, where at someone's appointment, doctor's appointment, I'm not feeling well, I don't want to go. Well, if you're not feeling well, all the more reason to go to the doctor. So don't assume things. We used to hear, what do you want? She's 85 years old. It's not normal aging. So see your doctor. Make sure you find out about the disease course. If you get a diagnosis, whatever it is, educate yourself on that disease process. And if you're a caregiver, get help. You can't do it by yourself. I don't care. Most diseases, whether it's memory loss or not, to do it safely and to be there for that person that you love and you want to care for, make sure you take care of yourself too, because we're usually heroic and we're the last ones to ask for help, but help is going to keep that person at home.
I think women are the worst too, because we're used to being moms and we're used to being a caretaker. Nurses, the same thing, anyone in the healthcare field. So those are great messages.
And no one can take care of your husband like you can. You feel that.
Exactly. Exactly. And he doesn't want anyone to do that either. So
true.
Yes. Well, this has been wonderful. Thank you so much.
Thank you for inviting me.
Thank you for coming, and thank you to our viewers for tuning in today. And our next show is going to be about the new cardiac rehab program in Lancaster. So definitely check back with us, and we'll have an exciting couple of guests. And I want to leave you with, start today to change your tomorrows and live your best life every day starting today. This is Sherry Keating. Thank you, and have a great day.